Obsessive-compulsive disorder. Diagnosing obsessive-compulsive disorder according to the DSM-5. Obsessive-compulsive disorder, OCD, is diagnosed when individuals have obsessions or compulsions, or both, that take lots of time and impair their functioning. Obsessions are upsetting thoughts, impulses, or images that pop into a person's head and will not simply go away, despite the person's attempts to ignore or stop them or to satisfy them by performing a compulsion. Compulsions are repetitive behaviors, for example, washing hands, ordering, checking, or mental acts, for example, praying or counting, that individuals believe they must do to neutralize their obsession or prevent some dreaded event, even though these compulsive acts are excessive or ineffective. Obsessive-compulsive disorder differs from obsessive-compulsive personality disorder. Obsessive-compulsive personality disorder is a chronic lifestyle governed by perfectionism, obstinacy, and rigid habits, but lacks the specific obsessions and compulsive rituals found in OCD. I decided to focus on the treatment of obsessive-compulsive disorder and how a patient's unwillingness to receive treatment can affect their results. The treatment of obsessive-compulsive disorder usually involve drugs that inhibit the reuptake of serotonin, SSRIs, or cognitive behavioral therapy, CBT, which typically takes the form of exposure and response prevention. A patient with OCD may be unwilling to receive treatment because it's hard for them to let go of their habits or beliefs. Dispositional resilience in treatment-seeking patients with obsessive-compulsive disorder and its association with treatment outcome. The study in this article explores connections between dispositional resilience, which consists of three components: beliefs in having control in everyday living, having a sense of purpose or commitment, and a positive attitude towards challenges. Symptom severity in OCD patients, and treatment outcome after concentrated exposure therapy, CET, and compares them with scores from two groups known to have high dispositional resilience, students and soldiers. Participants. An OCD sample, which consists of 89 people diagnosed with obsessive-compulsive disorder with a mean age of about 32, all with varying workplaces or unemployment, and 33 with simultaneous diagnoses. A military sample, 222 privates serving in the armed forces with an age range of 18 to 23, mostly male, and a student sample, which consists of students from the University of Bergen in Norway, 354 students with a mean age of about 22. Measures. OCD symptom severity was measured using the Yale-Brown Obsessive-Compulsive Scale. Interviews were conducted pre- and post-treatment and at follow-ups. Resiliency was measured by the Dispositional Resilience Scale 15 Revised, which is a questionnaire consisting of 15 items measuring the commitment, control, and challenge facets of dispositional resilience. Results. OCD patients scored lower on the dispositional resilience scale compared to the soldiers and the students groups, both pre- and post-treatment, the largest difference being in commitment. The OCD groups scoring lower on this scale post-treatment could mean they're more vulnerable to relapse. The results also show that resilience scores of patients don't relate to the results of their treatment significantly, but they might play a role in maintaining the effects of the treatment. Limitations. Not enough participants with both pre- and post-treatment resiliency scores, an uneven age and gender range, the lack of a comparison group consisting of other psychiatric patients. Using caffeine on the patients as therapeutic option against treatment-resistant obsessive-compulsive disorder. This study compares the management of treatment-resistant OCD patients using caffeine with patients given a placebo. Participants. A total of 62 patients, 31 treatment and 31 placebo, aged between 18 to 55, referred to the psychiatric clinic Imam Hassan Hospital in Tehran. They were evaluated for underlying variables, vital signs, and severity of OCD symptoms using the Yale-Brown Obsessive-Compulsive Scale. Exclusion criteria includes pregnancy, history of drug abuse, suicidal history, the presence of psychotic symptoms, being unwilling to continue or follow the rules of the study, and cardiovascular disease. Measures. Along with any previous medication, patients were either treated with a caffeine tablet or a placebo every day, the patients being randomly split into these two groups, the dosage of the treatment increasing throughout the weeks. After 8 weeks of treatment, the patient's OCD severity was tested again using the Yale-Brown Obsessive-Compulsive Scale. Results. The results of this experiment prove that caffeine has a significant effect on the reduction of OCD based on the Yale-Brown Obsessive-Compulsive Scale. OCD symptoms in the treatment group decreased by about 12%. Limitations. Further studies are needed to fully confirm the effectiveness of caffeine as a treatment and whether it's more efficient than other treatments. The patient's feelings toward caffeine should also be evaluated during participant choosing, and the dose of caffeine should be determined and distributed based on a specific patient's tolerance for it. How willing are you? Willingness as a predictor of change during treatment of adults with obsessive-compulsive disorder. The purpose of this study is to find out if willingness to receive treatment and endure the unpleasant thoughts and emotions accompanied with exposure and response prevention, ERP, affects treatment response. Participants. The study consisted of 288 participants in an intensive residential treatment for OCD. Their mean age was 31, and the average length of their stay was 50 days. Participants were included if they attended a week of treatment and met the criteria for OCD according to the questionnaires and interviews in the method. Measures. The following questionnaires and interviews were given in order to gain information. NET-SCID. A clinical interview that assesses the presence of Axis 1 disorders according to the DSM-4-TR criteria. Yale-Brown Obsessive-Compulsive Scale measures the severity of a person's OCD symptoms. ERP feedback form assesses willingness of a person from their own report at 3 separate times: before exposure and response prevention, ERP, immediately after ERP, and about future exposure to ERP. Results. The data shows that higher willingness, according to the ERP feedback forms, at any time during a patient's treatment enhances the results of exposure and response prevention. Higher willingness also lessened attachment issues and ritualization in OCD patients. Limitations. The study used inpatient participants with severe OCD who were impaired because of their illness. For example, they had low employment. Self-reports were what made up the research, making it prone to response bias, and the willingness test lacked psychometric testing, only a self-report. Conclusion. The 3 articles I chose revolve around a person with obsessive-compulsive disorders' unwillingness to receive or keep up treatment. People with OCD may avoid treatment, be afraid of change, or just don't keep up with the treatment they need to recover. This is why it's hard for many people with OCD to fully recover. The first article shows the lower rates of resiliency in OCD patients compared to other more commonly resilient groups. The second article shows an alternative treatment that may be more appealing to treatment-avoidant OCD patients. The third article proves how willingness to receive treatment can affect their therapy results.